I'm in Phoebe's Carlton Breast Health Center with Phoebe oncologist Dr. Kumud Rangaraj and Phoebe radiologist Dr. Shaila Sapati. Breast cancer deaths peaked way back in the 1980s, and thankfully they have dropped by nearly 40% since then. Dr. Rangaraj, tell us what is behind that large drop.
Sure. So screening modalities have increased tremendously, and access to screening has also improved. So we're detecting cancers at an earlier stage where they're curable. Additionally, there's been significant advancements in treatment that is very effective. So I think all of that has contributed to the drop.
Dr. Sapati, talk to me about Phoebe's high-risk breast cancer and genetics program.
Yes, we just started this program where all the patients that come for a mammogram, whether a screening or a diagnostic, are given a set of questionnaires. And if the patient is deemed to be high risk based on those questions, then we talk to the patient about if she wants to go additional testing. And if the patient agrees, then we have a nurse that comes and draws the blood sample. And then patient gets to see a video about what to expect from the results. And then she can also talk to a genetics counselor. And later, when when the results come, she can opt for further evaluation with a medical oncologist.
Now, there's also a new law in Georgia aimed at helping women at high risk of breast cancer. Explain Margie's law.
Yes, this is the new buzz, and it's called the Margie's Law or House Bill 62, where it says that patients need to be notified when their breasts reach a certain density. And the reason being, especially women with heterogeneously dense or extremely dense breasts, the reason is this has been shown to be an independent risk factor for breast cancer. And the understanding is the patients that get notified will talk to their primary care or the referring physicians about what else they need to do as supplemental testing based on other risk factors the patient may have.
Dr. Rangaraj, what kind of treatment options and services do we offer women with breast cancer here at Phoebe?
Sure. So we have a number of skilled surgeons that do breast surgery, including those that are specially trained in cancer surgery, including breast cancer. Additionally, all of our patients are discussed at a multidisciplinary conference where we have all the experts that treat breast cancer present at that meeting, so we can all come to a consensus as to how best to treat that patient. We also have the latest advancements in radiation technology here, and some really great and talented radiation doctors. We have our genetics program. In addition to that, we have a team of social workers that helps patients and helps them guide through the entire process. And we have our survivorship program. Once treatment is completed, we meet up with patients and kind of let them know what their expectations can be. How do we monitor for disease recurrence? What can they do on their end to reduce the risk of cancer coming back? And of course, the chemotherapy and other treatment options that are available, including hormonal treatment, targeted therapy, immunotherapy, in addition to the conventional chemotherapy.
How important is that whole team approach?
It is extremely important, and in my opinion, it is the crux of the oncology service line here. Because imagine, everybody kind of has a platform to ask questions, and that way, the patient would be benefiting from the input of all of these doctors at the same time.
What are the current screening guidelines?
Okay, the current screening guidelines according to the American College of Radiology is asymptomatic women, they can start screening from age 40, and it's an annual screening. And the women can have screening as long as she wants it. And in the high-risk patients, like patients whose family history, they can talk to their doctor and start screening earlier.
Dr. Sapati and Dr. Rangaraj, thank you so much for your expertise.
Thank you. Sure. Thank you.